what is health? Health is a state of complete physical, mental, and social well being, and not merely an absence of disease or infirmity. We say no that we don't have a disease, so I'm a healthy person, I have a good health. So, not only that, you should not have a disease, that is correct, but you should also have a complete physical, mental, and social well being. Then only a person will be healthy person. Okay. So, being healthy is well-being in physical, mental, and social aspect. To remain healthy, we should regularly eat a balanced diet, do a regular exercise, and take adequate rest. Okay. So, to become healthy or to remain healthy, we should eat a balanced diet. Proper carbohydrate, protein, fat, everything should be in a balanced condition. Do certain type, little or more as you wish, as your body permits. So do the exercise regularly, and adequate rest is also required to remain healthy. Okay. Then opposite of being healthy is a disease. Okay. So what is disease? Then we come. Okay. So we come to the disease. Now, disease is any physical or functional change from a normal state that causes disconnect or disability or affects the health of a person. Okay. So, it is of any physical or functional change from a normal state. Any normal person what is having any change from that state, whether it is physical or functional change, which is causing him to disconnect or disability or affecting the health of that person, that is known as disease. It's the state which is the disease. Okay. State of a person. Now, so a person is said to be suffering from a disease when the normal structure or function of their body is harmed or weakened, and it does not work properly. You are feeling tired, you are feeling feverish, so your body temperature is high. It's normal, no, it's not normal. So that is a disease for that person. Now, disease are of two types, that is communicable disease and non-communicable disease. Now, first we come to communicable disease. Now, what is communicable disease? Communicable disease is a disease which are passed on from one infected person to a healthy person. From an infected person to a healthy person, when the disease passes on through contact, air, water, food, or other organism, that disease is known as communicable disease. The other name of communicable disease is infectious disease. Okay. Now, also called, these are caused by microorganisms. Okay, these microorganisms which cause a disease is known as pathogen or germs. Okay, for example, bacteria, virus, fungi, protozoa, or worms. These cause diseases. So these are the pathogens or germs which cause these communicable diseases. Now, example of these type of diseases, communicable diseases like influenza, measles, malaria, dengue, chikungunya, AIDS. Okay. Even swine flu, which is known as H1N1, is also an infectious disease which is caused by swine influenza virus. It infects cells deep in the lungs. Okay, it infects the cells which are in the lungs, but in the deep lungs. Okay, when it can cause pneumonia, and in severe cases it can cause death. Next, we come to some of the communicable diseases. How are they caused, by which agent they are caused, and how are they transmitted, what are the symptoms and what are the preventive measures. So first we come to influenza. So influenza is caused by myxoviruses. It's a group of virus. Okay, it's a viral disease. It's caused by myxoviruses. and mode of transmission is a droplet infection through coughing, sneezing and spitting. Now symptoms are sudden fever with headache, sore throat, muscle pain, coughing, sneezing, etc. Now how can we prevent this influenza? Keeping away from the infected person. When somebody is infected, keep distance from that person so that you do not get infected by that any mode of transmission. Then you should cover your mouth and nose while coughing and sneezing. If you are infected, then you should cover your nose and mouth so that the other persons are not infected from you. Now second name of the disease is the measles. Measles is caused by paramyxovirus. Okay, it is caused by paramyxovirus. Then it is the mode of transmission is viral droplet infection through coughing, sneezing and spitting. Now here the symptoms are sore throat, runny nose, watery eyes, dry cough with fever, and small white spots appear on the inner walls of the cheek. Some white spots appears. Then the red rashes appear first in the neck and then the whole body. Okay, within a week the rashes fade away, leaving brown colored spots. Where the rashes have come out, there will be brown colored spots will be there. After the measles, this red rashes vanish. The preventive measures are, you should be given MMR vaccine, okay, given to a child at the age of 9 months to 15 months. MMR vaccine, if a child is given from 9 to 15 months, then this can be prevented. This measles can be prevented. And if a person gets measles, he or she should be kept isolated from the others for 12 to 15 days. He should be kept away. Okay. Next we come to malaria. Malaria is caused by Plasmodium species. It's a protozoa. Okay. Here the mode of transmission is through the bite of infected Anopheles mosquito. Here Anopheles mosquito is the carrier of this Plasmodium species. It carries mosquito carries the Plasmodium species, and when it bites the other person, when the Anopheles mosquito bites an infected person, it takes up this Plasmodium from the infected person into its blood, and when it sits on a healthy person, it spits into that, it injects that Plasmodium into the healthy person, and the healthy person gets infected by this or with this malaria. Now symptoms are parasite, this Plasmodium parasite, it multiplies in RBC and destroys them. Okay, and alternate phases of chill and high fever repeatedly comes in a day or 3 to 4 days. Okay, he will be totally chill, and then again he will have a high fever, and then vomiting and severe headache is there. Fever subsides with profuse sweating. When the fever is subsiding, you will get a profuse sweating. Okay, so these are the symptoms of this malaria disease. Then what are the preventive measures? Preventive measures is prevent mosquito breeding by spreading insecticides or oil over the water so that the mosquito does not breed. Then using mosquito net while sleeping. Then using mosquito repellent cream or ointment so that there is no mosquito bite. And then taking anti-malarial drugs such as chloroquine. Okay, that this anti-malarial drug is taken when the person gets malaria. Okay. Next we come to the dengue. Now dengue is also caused by mosquito. Its a causative agent is barbovirus, and the mode of transmission is Aedes mosquito. Aedes mosquito is the carrier. Okay. Here also there will be high fever and severe muscle and joint pain, pain behind the eyes, nausea and vomiting sensation, red color rash over the skin from the 4th to the 6th day of the infection. Platelet count goes down considerably, even as low as it can go down to 20,000. Now bleeding from the gums, nose and bruising can happen. And preventive measures are prevent mosquito from breeding again by spreading insecticides or oil over in the water coolers or stagnant water. Okay, then do not let water stagnant, okay, in broken bottles, pots, coolers, tires where the mosquito breeds. Okay, avoiding mosquito from breeding. Chikungunya, it is also a viral infection caused by chiku. It's an alpha virus. Okay, and its mode of transmission is, again, it is infected by Aedes mosquito. Okay, the bite of the Aedes mosquito, the Aedes mosquito is the transmitting agent. Then the symptoms here are high fever with severe muscle and joint pain. Joint pain is often severe and can last from weeks to months. Okay, altogether. Then headache, nausea, fatigue and rash can happen. Okay, and the symptoms often they are confused with those of the dengue, because dengue and chikungunya, they have almost the similar symptoms. Okay, then the preventive measures is we have to take medicines to relieve the symptoms. Okay, so we come to the next, that is acquired immunodeficiency syndrome. Okay, so this human immunodeficiency virus, okay, and it is caused by exposure through blood, blood when it comes out through cuts or wounds. It can be transmitted, it can cause, it can infect through those. Okay, a person can be infected from these cuts or any wounds. Then sexual contact, then organ transplant, blood transfusion. Therefore, mother to child during pregnancy and childbirth, this can also happen during this transfusion, or from when the mother is pregnant, then from the mother to the child it can be transferred, that is HIV can be transferred, AIDS can form. Then the symptoms are breakdown of the immune system, severe weight loss, person feels fatigue and tired, persistent dry cough and oral rash and shortness of breath, headache, visual disturbances, gastric problem, regular diarrhea. Okay, then lung diseases like pneumonia, damage to the brain leading to memory loss. Due to the breakdown of the immune system, the person becomes susceptible to many infections. What happens as the immune system goes down in this case? What happens? Any infection can can attack this person, the person who has HIV. Okay, and the preventive measures are screening of the blood during transmission. Okay, proper screening is needed for during transmission, during blood transfusion. Then avoiding sharing and reuse of the blades, needles and syringes and surgical instruments. Okay, then avoiding pregnancy. If the mother is HIV positive, then the mother should avoid pregnancy. Then safe sex. Then educating people. By educating people also we can stop this HIV spread. Okay, so next we come to the vector. See, vector is an organism that carries the disease causing germs, that is the pathogens, from a source of infection to a healthy individual without getting infected itself. Okay, like mosquitoes or Anopheles or Aedes, they carry the diseases, they carry the disease causing germs from one infected person to the other normal person. Okay, so mosquito is the vector. So mosquitoes, houseflies, mites, as well as mammals like rats and dogs, these are all vectors. When these insects or mammals bite a person suffering from the diseases like malaria, dengue, plague, yellow fever, sleeping sickness or kala azar, then the germs enter the body of the insect, and when these insects or mammals bite a healthy person, the disease causing germs are injected into the bloodstream of that healthy person and thus causing the person infected. See, for this, what happens? The certain vaccines are given to protect as a preventive measure to protect the infants and child from certain diseases. Okay, it's like the infants at the birth, they are given BCG and OPV vaccine, oral polio vaccine, and BCG is bacillus vaccine that is given for tuberculosis. Okay, then for when the infant goes to 6 weeks, the infant is given DPT or and OPV again. 10 weeks also DPT and OPV. 14 weeks also DPT and OPV. 9 months measles vaccines is given. 18 months DPT, OPV, all those are booster doses. Okay, then 5 years DT vaccine is given. Then 10 years the tetanus toxoid is given. 16 years tetanus toxoid is given. See, during birth the BCG vaccine is given for tuberculosis and hepatitis B. First dose is given. Okay, this is done to protect the child from tuberculosis as well as tuberculosis from at the time of birth, immediately after the birth. Then 6 weeks when the child is at 6 weeks, DTP, then OPV first dose. Okay, then hepatitis B second dose, rotavirus first dose is given, PCV first dose is given. Okay, so these are given according to the age of the baby, and these are given to prevent the child from infection. Okay, then again 10 weeks some vaccines are given. Okay, then 14 weeks also, then 6 months also the vaccines are given so that the child gets protected. Okay, and these are protected some from different diseases. Then how do we prevent what are the prevention of the disease? How do we prevent the diseases? There are natural mechanisms are there and general methods are there. First, if we come to the natural mechanisms, how they maintaining the personal and community hygiene. First and foremost is to maintain personal and community hygiene. Then avoiding unhealthy habits and lifestyle. Then vaccination against specific diseases. Like I told you, the vaccines are given to the child from the childhood only, from the birth only rather. They are given to protect the child from different specific diseases like chickenpox, hepatitis, poliomyelitis, etc. Then general methods by preventing exposure to infectious microbes, preventing exposure to airborne microbes, living in healthy and hygienic conditions. Okay, by living in the healthy and hygienic conditions, airborne diseases, airborne infections can be prevented. Then we can prevent waterborne diseases by drinking clean and safe drinking water. Then by treating water to kill microbes contamination, or by boiling the drinking water, we can avoid this waterborne diseases. Then preventing the vector-borne diseases by cleaning our surroundings. okay, so that disease carrying vectors do not flourish there. Okay, like if we avoid the mosquitoes breeding, then we can avoid malaria, dengue, etc. Then by providing proper and sufficient food, okay, then we can build our immune system better. Okay, immune system functions well and it can prevent diseases.